The Ebola outbreak in the Democratic Republic of the Congo is spreading rapidly. Previously, WHO assessed the risk as high at the national and regional levels and low at global levels. We're now revising our risk assessment to very high at the national level, high at the regional level, and low at global level. So far, 82 cases have been confirmed in DRC, with 7 confirmed deaths. But we know the epidemic in DRC is much larger. There are now almost 750 suspected cases and 177 suspected deaths. The situation in Uganda is stable, with 2 cases confirmed in people who travel from DRC, with 1 death. The measures taken in Uganda, including intense contact tracing and cancelling the Martyrs' Day commemoration, appear to have been effective in preventing the further spread of the virus. An American national who was working in DRC has also been confirmed positive and transferred to Germany for care. We're also aware of reports today about another American national who is the high-risk contact who has been transferred to the Czech Republic. The governments of DRC and Uganda are leading the response with support from WHO and partners. In addition to our national staff in DRC, so far we have deployed 22 international staff to the field, including some of our most experienced people. And we have released $3.9 million from the contingency fund for emergencies. We're also in touch with UN humanitarian chief Tom Fletcher, and I thank him for allocating $60 million to the response. Yesterday, WHO convened the leaders of several partner organizations under the Interim Medical Countermeasures Network to review the pipeline of vaccines, therapeutics, and diagnostics. The WHO R&D blueprint has also convened its technical advisory group on therapeutics and recommended to prioritize 2 monoclonal antibodies to advance in clinical trials. In addition, the advisory group recommended the evaluation of antiviral obeldesivir in a clinical trial as post-exposure prophylaxis for people who are high-risk contacts. This clinical trial is now being developed jointly with Africa CDC and the Collaborative Open Research Consortium on filoviruses. We're also discussing with partners candidate vaccines in the development and manufacturing pipeline. As you know, the provinces of Ituri and North Kivu, in which the outbreak is occurring, are highly insecure, with intensified fighting in recent months, causing more than 100,000 people to be newly displaced. Across both provinces, around 4 million people need urgent humanitarian assistance, 2 million are displaced, and 10 million face acute hunger. There is also significant distrust of outside authorities among the local population. Just yesterday, there was a security incident at a hospital in Ituri where tents and medical supplies were set on fire. Building trust in the affected communities is critical to a successful response and is one of our highest priorities. Now, a brief update on the hantavirus outbreak among passengers and crew on board the cruise ship MV Hondius. Today, the Netherlands confirmed an additional case among a crew member who disembarked in Tenerife, was repatriated to the Netherlands and has been isolating since then. There are now 12 reported cases and 3 reported deaths. No deaths have been reported since the 2nd of May, when the outbreak was first reported to WHO. We continue to urge affected countries to monitor all passengers and crew carefully for the remainder of the quarantine period. More than 600 contacts continue to be followed in 30 countries, and a small number of high-risk contacts are still being located. Once again, I thank the many countries that have cooperated in the response and the epidemiological investigation. Argentina, Cabo Verde, Chile, Netherlands, South Africa, Spain, the United Kingdom, and the European Union.